Okay, so we're going to talk now about pressure ulcers, which is a very specific type of wound we see a lot of in healthcare. The stages of a pressure ulcer. The first stage is not actually a stage. We're talking about suspected deep tissue injury. In suspected deep tissue injury, the skin is intact, but it's deeply discolored. And what's happened, we see this a lot of times on heels. The bone is compressing tissue against the mattress or some other surface. So the patient's on their back, their heels are pressing down onto the bed, and the pressure between the mattress and the bone smashes that tissue. And that tissue becomes ischemic, it's lost perfusion because it's being smashed. And they can have really pretty severe damage and no broken skin. So that's suspected deep tissue injury. The skin is intact and the heels are deeply discolored. So it's going to look like purplish, usually purplish or really dark in that space. So pay attention for that. Now, when we get to pressure ulcers, stage 1, we still don't have any broken skin. Stage 1 is non-blanchable erythema. That's when the skin over bony prominence is red, but it doesn't blanch. You can't push on it, make it white, make it go away. So the redness is there. Okay, that's stage 1. That tissue is on its way to breaking down. Stage 2 is partial thickness. There's either a blister or an open area. You'll see this a lot on the coccyx. It involves the epidermis and the dermis. So now we have open skin. Now we have risk for infection. Stage 3, is full thickness skin loss. There may be loss of subcutaneous tissue, and it extends to the fascia, but not through it. Stage 4 is full thickness tissue loss. It goes into the fascia. It can go into the muscle, bone, and surrounding structures. If a wound is covered by eschar, that thick black crust, it cannot be staged. It is an unstageable wound. Pressure ulcer assessment. First of all, you need to know how to use a risk assessment tool. Risk assessment tool. A lot of facilities use the Braden scale. Some use the Norton scale. I would like for you to all go find the Braden scale. Okay, you can find it online. And just pick a random person and do a Braden scale pressure ulcer risk assessment on that patient. It's usually done at admission. For long-term care, it's repeated at intervals, and some acute care facilities are repeating that at intervals as well. So if we know that a patient is at greater risk, then we're going to take steps to prevent those wounds. We also need to monitor all clients for skin integrity and all clients for risk factors. So when a patient enters your facility for the first time, you should document a full skin assessment. And we don't always do this. We're in a hurry. We're trying to deal with what's going on with their right now needs. But if a patient is admitted to the hospital and they don't have a wound and they leave the hospital with a pressure ulcer, Medicare does not pay for that stay. So you really need to be documenting whether they have a wound already when they come in. And then we want to see, are we making it worse or better? There are risk factors for pressure ulcers. So what happens with a pressure ulcer is the skin and the tissue get trapped between a bony prominence and a hard surface or a firmer surface. So where are we going to see those? We see them on the sacrum and on the hips when patients are in bed, when they're bedbound. Think about that, on the sacrum and on the hips if they're bedbound. We also see them on the heels if they're bedbound. We might see them on shoulders, on elbows. If someone is very thin and their knees are pressed together, we may see those on the knees because the knees are pressing that skin. So think about everywhere there's going to be pressure. Okay, think about bony prominences. So some risk factors. Aging skin is a risk factor. So aging skin is more delicate, and it also tends to break down more easily. And it takes longer to heal, sorry. Immobility. So if a patient cannot move themselves, they cannot adjust. When you're sitting in a chair, when your tissue starts to get compressed and it's not getting perfused well, it hurts. And so you move, you adjust. Someone who is unable to move and adjust their weight is at risk. Okay. Incontinence or moisture increases the fragility of skin. So if a patient is incontinent or if they're exposed to a lot of moisture, maybe they perspire a lot, they're at greater risk. Skin friction and shearing. When we move a patient in bed, you may have been encouraged in your employment to move a patient independently. I don't need help. I can do my job. You're not doing your job if you have to have help. I'm going to tell you that not just even, but especially the 90-pound patient that you could pick up, if you pull them up in bed by themselves, you're shearing the skin off of their bottoms. Okay. Get help to move patients in bed. Don't pull them up in bed by yourself. Get help. You want to lift them up off the bed as much as possible and move them upward. So skin friction and shearing. Vascular disorders, because if we don't perfuse well, that tissue is going to be at greater risk and it's going to be damaged. Obesity, because of the slower healing of fat tissue. Inadequate nutrition, especially inadequate protein. Dehydration, hydrated tissue. Hydrated cells are plump and they're harder to damage. Hydrated tissue damages more easily. Anemia, because we're not getting adequate oxygen to the tissues already. Impaired circulation. Fever, if a patient has fever, they're more at risk for skin breakdown. Sensory deficits. If someone cannot feel that sensation of, oh, I need to shift weight, they may not remember to do that. Cognitive or neurologic impairment, they may not be able to interpret that sensation and act appropriately. Chronic diseases, sedation for obvious reasons, and patients who are very thin. So most of those make a lot of sense. We just don't always think of them. So we have an organized way of assessing that risk when the patient comes in. We're going to talk in the next section about preventing and treating pressure ulcers.